You are likely sitting at your kitchen table right now. Or perhaps you just finished your morning routine, believing you have done something good for your body. You poured a glass of white liquid, or maybe you splashed it over a bowl of crunchy flakes, thinking about your bones. You have been told for decades that this specific food is the foundation of health. But what if I told you that this very habit, this innocent breakfast ritual, is acting like high-octane fuel for prostate cancer cells? You are terrified of genetics. You are worried about bad luck. But meanwhile, you are spoon-feeding your prostate the exact growth factors it needs to mutate and swell. We need to talk about the dairy lie, and we need to talk about it right now. My name is Dr. Emily Carter. I'm a board-certified urologist with 25 years of experience treating thousands of men for benign prostatic hyperplasia, prostatitis, and prostate cancer. I do not strictly follow the standard dietary guidelines because, frankly, the standard guidelines are keeping you sick. In my clinic, I see men who follow the rules and still end up in surgery. Today, we are going to break those rules to save your life. Let me tell you about a patient of mine named William. When William first walked into my office, he was 64 years old. He was a retired structural engineer, a man who loved logic and precision. He looked healthy on the outside. He was not overweight. He did not smoke. He exercised 3 times a week, but William was miserable. He was waking up 4 or 5 times every single night to urinate. His stream was weak, hesitant, and painful, but the most alarming part was his blood work. His PSA levels, which measure prostate-specific antigen, were creeping up into the danger zone, sitting at 6.5. He was terrified of a biopsy. He told me, "Dr. Carter, I eat a healthy breakfast every day. I drink my milk for calcium. I eat my fortified cereal. I drink my orange juice. I am doing everything right." I looked at him and said, "William, you are doing everything right for a growing child, but you are doing everything wrong for an aging prostate. You are accelerating the very disease you are trying to avoid." William's story is not unique. It is the story of millions of men over 60 who have been misled by marketing campaigns that prioritize sales over cellular biology. Today, we are going to deconstruct the 3 enemies of your prostate that are hiding in your healthy breakfast, and then I will give you the exact protocol I gave William to reverse his symptoms. The first and most dangerous enemy is cow's milk. I know this is controversial. I know you have been told milk builds strong bones. But for a man over 60, commercial dairy is a biological hazard. Here is the science that most general practitioners will not take the time to explain. Cow's milk is designed by nature for one specific purpose: to turn a 60-pound calf into a 700-pound cow as rapidly as possible. It is loaded with anabolic hormones. The most problematic of these for you is called insulin-like growth factor 1, or IGF-1. When you consume dairy, your levels of IGF-1 rise. In a calf, this stimulates rapid cell division. In a man over 60, rapid cell division in the prostate is the last thing you want. High levels of IGF-1 have been consistently linked in medical literature to an increased risk of aggressive prostate cancer. Furthermore, the high calcium content in milk behaves strangely in the male body. Excessive calcium intake downregulates the production of the active form of vitamin D3. Vitamin D3 is a potent anti-cancer hormone that protects the prostate. So, by drinking that tall glass of milk, you are flooding your system with growth factors, while simultaneously shutting down your cancer defense shield. The second enemy often accompanies the first, and that is fortified breakfast cereals. Look at the box. It proudly claims to be fortified with vitamins. This sounds excellent, but it is a trap. Specifically, these cereals are sprayed with synthetic folic acid. Natural folate, found in leafy greens, is wonderful. But synthetic folic acid is not easily metabolized by the body, especially in older men. Unmetabolized folic acid circulates in the blood and can confuse the immune system. Some studies suggest that high intake of synthetic folic acid rather than preventing cancer, may actually fuel the growth of pre-existing precancerous lesions in the prostate. You are eating a bowl of processed grain, spiking your insulin, and confusing your immune system with synthetic vitamins it cannot process. The third enemy is the glass of commercial orange juice sitting next to the cereal. You think it is vitamin C. Your body sees it as a sugar bomb. A 12-ounce glass of orange juice contains as much sugar as a can of soda. When you drink this on an empty stomach, your blood glucose spikes, forcing your pancreas to pump out massive amounts of insulin. High insulin is inflammatory. Chronic inflammation is the soil in which prostate enlargement and cancer grow. Insulin also increases the liver's production of that same IGF-1 we discussed earlier. So, the milk provides the growth factor, and the juice stimulates your body to make even more of it. It is a perfect storm for prostate disaster. So, what do? If we take away the cereal, the milk, and the juice, what is left? Do not worry. We are going to replace these enemies with heroes. These are 3 specific foods that act as medicine. Hero number 1 is lycopene, but it must be prepared correctly. Lycopene is a powerful antioxidant found in tomatoes that gives them their red color. It specifically accumulates in prostate tissue and protects DNA from damage. However, eating a raw tomato is useless. The lycopene is locked inside the cell walls. You must eat cooked tomatoes, tomato paste, tomato sauce, or stewed tomatoes. Heat breaks down the cell walls and makes the lycopene bioavailable. Adding a little olive oil increases absorption even further. Hero number 2 is green tea, specifically for its compound EGCG. This compound is an anti-angiogenic agent. That is a fancy way of saying it stops tumors from creating new blood vessels to feed themselves. It essentially starves the bad cells. Coffee is fine, but green tea is medicine. Hero number 3 is pumpkin seeds. The prostate gland contains the highest concentration of zinc in the male body. Zinc is critical for prostate function and DNA repair. As we age, our zinc levels drop. Pumpkin seeds are one of the most potent natural sources of zinc and also contain phytosterols that help shrink an enlarged prostate. Now, get a pen and paper. I am going to give you the specific protocol I gave to William. This is not a suggestion. This is a prescription for your health. Step 1 is the elimination. For the next 30 days, you must remove all fluid dairy from your diet. No milk, no cream, no ice cream. Small amounts of cheese or fermented yogurt are acceptable occasionally, but the liquid milk must go. Step 2 is the morning replacement. Instead of cereal, I want you to eat oatmeal, but not the instant sugary packets. Use steel-cut oats. But here is the trick. Mix in 2 tablespoons of ground flaxseed. Flax seeds contain lignans, which help modulate hormone levels and bind to excess estrogen. Men produce estrogen too, and as testosterone drops, relative estrogen rises, contributing to prostate growth. Flaxseed helps balance this. Step 3 is the supplement protocol. I recommend 3 specific supplements to bridge the gap. First, take 320 milligrams of saw palmetto extract daily. Make sure it is a high-quality standardized extract. This helps block the conversion of testosterone into DHT, the hormone that swells the prostate. Second, take 50 milligrams of zinc picolinate. Picolinate is the form best absorbed by the body. Take this with food to avoid nausea. Third, take 5,000 international units of vitamin D3 combined with 100 micrograms of vitamin K2. Remember, by stopping dairy, we need to ensure your calcium goes to your bones, not your arteries or kidneys. And K2 is the traffic cop that directs calcium to the right place. We also need to discuss synergy and sabotage. The synergy comes from combining your cooked tomatoes with healthy fats. If you eat tomato sauce, put olive oil or avocado with it. The fat transports the antioxidants. The sabotage comes from alcohol. If you are struggling with frequent urination at night, alcohol is your worst enemy. It is a diuretic and a bladder irritant. For this 30-day reset, I need you to limit alcohol to 1 drink per week, or cut it out entirely. So, what can you expect? Let's go back to William. He was skeptical. He loved his milk, but he was desperate enough to try. In week 1, William noticed something interesting. His bloating went away. He didn't realize how much the lactose and gluten were inflaming his gut. A less inflamed gut presses less on the bladder. By week 3, the night wakings dropped from 5 times to 2 times. He was getting blocks of 3 or 4 hours of sleep for the first time in years. His energy during the day skyrocketed because he was actually resting. At week 6, we retested his blood. His PSA had dropped from 6.5 down to 4.8. That is a massive shift in 6 weeks. His urinary flow was stronger and the urgency was manageable. He did not need surgery. He just needed to stop feeding the disease. This is your challenge. I am challenging you to follow this protocol for exactly 30 days. Stop the milk, stop the sugar, start the lycopene, zinc, and saw palmetto. You have nothing to lose but the sleepless nights and the anxiety. The medical industry wants you to believe that decline is inevitable. I am telling you that vitality is a choice. It is hidden in what you choose to put on your spoon every morning. Thank you for watching. Stay healthy.